Well, first I went to the doctor because I was having numbness that would start here in my lower half of my face, go all the way down my arm, go all the way down here, and it would actually do like this half of my chest. Like I would have numbness. So it kind of felt like a stroke, symptoms of the stroke, even though mentally I was completely, fine. But I did go to the doctor just to make sure I wasn't having a heart attack or a stroke or something weird. There was nothing going on with that. So they sent me off to neurology and they diagnosed me with migraines. And I did not agree with that diagnosis because I didn't think it was migraines. So I needed to get rid of that problem because it was really really scary when it would happen. Like, it just my half of my body was having electrical like craziness going on, and it was really really uncomfortable and scary and debilitating. So I tried physical therapy. That made it worse. That was going on for about 6 months. It's going on for about 6 months. And so I overheard a conversation. Yes, I was eavesdropping with my trainer at my gym who was singing your praises for some plantar fasciitis that she had. And so I decided to give you a call and have you work on my shoulder. I did have a Swedish massage lady who does really, really deep tissue, but she never really got to the bottom of it. Even though I knew there was more there, she just really wouldn't work on it deep enough. I think she was nervous or scared or whatever. But she's still really a great massage therapist, just the Swedish kind. But yours is just a little bit different. So I went to co see you and I did hear, you did give me warnings on how painful it was. And yes, it was painful. But I got immediate results. And after about 6 weeks, I think I saw you 3 times. I never have had that feeling again, ever. Not one single time. And now I'm able to exercise at my gym with full, you know, um, you know, curls, bicep curls and pull downs, all kinds of lat stuff. And it does not, and I'm able to do planks and it doesn't bother my shoulder in the least tiny bit. So you have really cured that. But what I didn't tell you on my first visit was how many other things I had going wrong in my body. And so, I was kind of afraid to tell you because I was afraid that you would be like, oh my gosh, I'm not touching this woman. It was a little bit of a test, to be honest, and you passed by many, many miles. I don't know where else I would have gone to get that kind of cure because nobody else does that kind of work that I'm aware of that you do. So I'm so grateful that I found you. So then we went to work on my neck, which my neck was a fat mess. And now we're working on my sciatica problem and I have a weird ankle problem. So we're working on both of those things now. My sciatica issue, which I've struggled with for like about 15 years, 15 years going to the gym, doing physical therapy on it did not help at all. I'd go to the doctor and I'd complain, this is really bothering me. Oh, yeah, let's get you into PT. And I'd go to PT and, most of the time it would just aggravate it. And so knew it wasn't doing what I needed to do, but I didn't know what else to do. So I wasn't really like, I mean, I was pretty miserable sitting, and most of what I do all day is sitting at a desk. Whose job doesn't really? So so when you were able to cure my shoulder, we started working on that. Not that I'm happy about your work because it hurts like a really, like you're so kind and patient during the sessions because I swear like a sailor. I just have no restraint. I have no restraint because it's so painful. It's, it's so worth it. And I'm glad you don't pay attention to it. I think after 3 sessions, I was 75% better. And it went really fast. The last 25%, that was a little bit more stubborn, but I think at this point I'm probably 90 to 95% better. I don't have any restrictions in using my shoulder at all. So I can work out, I can lift stuff, I can drag suitcases without my shoulder going, getting all upset with me and getting triggered and, getting into a bad place. So, and I do travel a lot. So I do use suitcases a lot. So, and I'm in retail, so I'm physical with my body. So, yeah, so really great success story for me. Swedish massage for me has been my mainstay for probably over a decade. I really liked it. I like it to go deep, but not to the point of a lot of pain, but to a point of a little bit of pain. But I never got long-term relief from it. And so I would get relief for a week or two, and then it would all come creeping back. It would just creep back, and there I'd be at the same place I was when I started, 2 weeks before. So I was seeing her every 2 weeks, and now I just see her less because I do enjoy the Swedish massage because there is a relaxation benefit to it, but I don't have the expectations of the curative value that you offer. But I still find value in her massages because she's amazing. But a lot of people recommend tennis balls or lacrosse balls or rolling out your body. Holy cow, that was just did not work for me at all. It made it worse for me for my sciatica for sure because I didn't really know where I was putting that thing. And, you don't really feel the negative effect of it until, 12 hours later. And then you're like, oh, dear God, what did I just do? And then it would take me 2 or 3 weeks to, with Salon Pause and Advil and Tylenol to get it to calm down. So even though your massages are super challenging to get through, and then the 24 hours can be kind of challenging to get through. Like sometimes it's not comfortable to sleep on that particular part that you went hard on. Um, in 24 hours, I feel a million times better. So I'm not doing any more rollers. Those are just disasters. I tied IT bands that just, oh my gosh, inflamed everything. Was worse, made my sciatica worse, was horrible. And stretching sometimes didn't really help. And stretching sometimes made it worse. And physical therapy made it worse. It certainly made my shoulder worse. And I went to the best gal that they had for it, but it was a complete disaster for me. Um, the doctors don't know what to do with you after physical therapy doesn't work. So, and you get a scan and oh yeah, everything's fine. Everything looks like it's supposed to look. But, in the meantime, you've got this huge knot and, you gotta get in there and fix that knot and get rid of it. And so grateful that I found you. We've been working on this sciatica hard for about 4 months. 4 months. Well, I had to skip a couple of our sessions, but I would say I'm at about 60%. Most of the time, it's really great, and then I do something and it flares it up a little bit, but then the flare recovers faster. So I think the more and more we're working on it, the better it's behaving. So I don't have a lot of pain sitting down anymore. I can actually watch a movie without being in pain on the couch. I can sit at my desk without being in enormous pain and having to put heating pads on it or whatever. I'm not really using heating pads like I used to. I didn't even think of that. I do take Salon Pause sometimes because those are very effective. So sometimes I need to sleep with those on my sciatic part, but I don't use it anywhere else. I don't use it anywhere else. So the sciatica is I think will be this is a deep rooted problem for me that I've had for a very long time. And oh gosh, you know, 15, 20 years, yeah, I have this, I have this knee issue where I've lost 30% of my knee cartilage because I tore it, and it kind of kind of ruined my gait, and I think it ruined my hip on the other side because the balance is wrong. So it's been going on for a long time. I tore my cartilage in the early 80s. So it's been going on for a long time. So it's really deep, but I'm getting so much better. I just can't even believe how much better I am. I'm so grateful to you. First of all, I'm not in pain, so I'm not managing pain and I'm not taking all those pain medications all the time. So that's huge. Uh, I'm more comfortable in my day-to-day life. I'm more functional. And, the biggest benefit for me is that I can go to the gym and I can work out and I can keep my body as I'm aging, stronger, to fight the aging process as much as I can. Yeah, so that to me is really, really valuable. All of those three things are really, really valuable. So, yeah, really, really helps to have you figuring out where all the stuck issues are. So we are getting there. So sciatica at 60% now, but I think we'll be at 90% probably by the middle of summer. I would say that if you want long-term healing from your issues, Alessandro is the guy to go see because you will get long-term relief from what he does. It will not be a very pleasant hour. I gotta confess that I do look sometimes at the clock and I'm like, oh dear God, I've got a half an hour left to go. It's painful. And sometimes I cry from my mom. But but it's only an hour. You will get through it, and he is very attentive to how much tolerance you have. So if you can't take if it's too much pressure, he is very attentive to finding the right amount for you. So it's not like, you're in pain because he's making you do it. You're in pain because you have that choice of this is how deep I want to go. I am one of those people that want to go deep. I can get through an hour of just, because he doesn't mind me swearing. I can get through that hour and have great results and pain relief from that. So I think that benefit is worth an hour, but I could go lighter and not have it be as painful. So, and he's very receptive to all of that. Just be sure to communicate and don't be shy. He's very open to whatever works for you. Because the long term is the game here. This is not, for me, this is the long term. So remember when we first started on my sciatica issue, I couldn't take any pressure. Yeah, barely touching me. So I'm super happy with the progress. Very, very happy. Grateful and happy. I highly recommend it. Highly recommend it. If you are in pain, come and see Alessandro.